Hello, going live here. This is Dr. Jon Grazer, a board-certified Newport Beach plastic surgeon, and I'm here right now in my private operating room. And you know, we've all been quarantined, and now everybody's wearing masks. And I really want to educate everybody how to use a mask. There's a proper way to do it, and you know, this really could be a lifeline. So you really need to wear your masks properly. There's a number of different masks. I'm not going to go through all of them, but you know, this could save your life, because if you want to wear the mask, you got to wear it the right way. You know, not wearing it the right way, really, you know, you might not protect yourself. So this is my regular surgical operating mask. Okay, I work every day with a mask my whole entire life. I'm used to masks, but there's a proper way to wear these masks. Okay, so this surgical mask is not reusable, but I mean, if you keep it clean and dry, you can use it for a day or two. If it gets wet, it's probably not going to be as effective. But if you look right here, there's a front and a back. It's just like wearing a pair of you know, Pampers or something. You have to have the right side in and the right side out. It's not going to work. The other thing that's really important is it's pleated, so you're not going to suffocate to death, and you got to wear the strings the correct way. Okay. The really important part at the top, there is a little metal strip, just like a twist tie on for a loaf of bread. Okay, so this is what seals your nose. Now, it's really interesting. I see a lot of people on TV wearing the mask with their nose out. That's not going to do anything. You got to cover your nose and your mouth, and you want it to be sealed properly. It doesn't have to be tight, but just snug, and you get used to it. I mean, I don't even think about these masks. I mean, it's not going to suffocate you. But the interesting thing is, you take the mask. One of the folks that worked for me, she came in with her mask. It was upside down and didn't even have it pinched. And you watch everybody on TV, their nose is hanging out. It's not pinched. So you got to wear it the right way. So what I do is I pinch it on the top. I tie the top one first, and I like my mask snug. And then you take the bottom mask and pull it. This covers your mouth completely, okay, and your face. And this will protect you from sneezing at other people. Now, these surgical masks are really just particulate. They're not like the N95 mask, and I'll show you those in just a little bit to tell you how to wear the N95 mask. But I think this will work. But these masks don't filter as well as the N95s. So if I can get my match lit, let's see. Watch. With this mask, I can blow out. I can blow out the match. So it doesn't filter that well. This will protect you from sneezing on people, but it's probably not going to, in an environment-laden room where people are coughing and really spewing a lot of particles. And this is really probably a particle-laden, not atomized, meaning that, you know, the droplets, the 6-foot ratio that everybody's talking about. So the thing that's really important, you tie the top part of the mask, you push it on your nose, and you put it down around the bottom. That's really important. And don't lick it, don't touch your face. You really want to keep everything as clean as you can, okay? So just don't touch. And this will remind you not to touch, and it'll keep you from coughing on people. When this is done, you don't want to touch the outside, because that's the dirty part, okay? So if you save it face down, untie the top part, untie the bottom part, and that's the best way to do it, okay? Now, these are two N95 masks. You hear a lot about the N95 mask. These are the ones that are in short supply that the healthcare workers can't get. They don't want you using these in public, but they're probably the safest if you can get them. I mean, you certainly don't want to take it away from the medical personnel and the personal protective equipment you've all been hearing about. But what does an N95 mask mean? It means that it filters out 95% of a 0.3 micron particle. So what's 0.3 microns? Okay, your fingernail is 1 millimeter. Okay, so 1,000 of that is a micron. So 3/100ths of your fingernail is what the virus particles are size. So this filters out the virus particles. So if you can get an N95 mask, these will last a day or two. Some of the hospitals are actually making people use these masks for an entire week. Probably not the safest thing, but you know, if that's all you've got, you got to protect. Okay, so fortunately, I think more and more masks are coming out, but you got to know how to wear these masks. Okay, so this mask is a fitted N95 mask. This is made by 3M, and the way you put this on is, again, this does have the foam strip on the top and the metal tab. You want to put that tab on first. Now, you don't want to touch the outside of the mask. When you put it on when it's clean, certainly you can. But the way you do it is you put the bottom strap on first around your neck. You put the top one on. Again, you got to pinch the metal piece here so you get the most filtering, okay? Now, you shouldn't be able to, you'll be able to smell perfume and things through it because it's very small atomized minimized particles. But this filters out 95% of the 0.3 microns. It's really important to keep this pinched. These will last for a day. These are 3 layers. These are the medical grade N95 masks you've all been hearing about, okay? So take off when you take these off, you don't want to touch the outside. You want to take the top one off first, and then the bottom one, and then you can lay this mask down like this. Don't touch the outside, and you can reuse it. This is another N95 mask. It looks like one of the surgical masks. But the one that's interesting about this, when I showed you a little bit before, this one also has the piece for the nose. And you can see if you bend it properly, it leaves a natural nose piece there. So that seals the mask. So you really want to seal it as much as you can so you don't get any of the bad particles, okay? So this one has the metal piece at the top. So make sure the metal piece goes up over your nose. Again, I'm going to put this one over. These aren't quite as easy as the other N95 mask. But again, I'm going to put the top string around my head and pinch my nose. The metal part always goes on the top, okay? So this is the way we do it. So now watch this mask. You won't be able to blow out the match because it filters more. So that's how you can tell the N95 mask or the really cheap mask. The cheap masks aren't going to protect you around somebody that's really coughing without a mask because you have aerosolized virus particles. But the mask will keep you, the regular mask, the homemade mask, and all the masks people are wearing will at least keep you from spewing a 6-foot to 10-foot radius of the viral particles. So it's really important to know how to wear your mask. So the metal part goes to the top, squeeze it. You're not going to suffocate. Make sure you don't touch the outside of and don't lick the mask because if the mask is wet, it's not as effective. The N95 mask guard's a different story. They'll work for a day even if they're a little bit moist. But that's the really important part. So it's important to wear your mask, wear them outside, and carry hand sanitizer. If you touch a doorknob, wash your hands. Anything you're touching, carry your own pen in your own pocket so you don't have to use somebody else's pen. Because, they're called fomites. I mean, you don't know where it's been. Even the coins in your pocket, the money. I mean, that's all been touched by somebody. So be careful, okay? Don't lick your eyes. Don't lick your mouth. Just really protect. And since I do have my own operating room, I'd let you know that we're available here. If you have an emergency, like a cut or a laceration, even a wound or a burn, you don't want to go sit in the emergency room and be exposed to all these people, even urgent care that are coughing, that have illness. Call me. I'm available. Our operating room is available to help you here. So we can take care of you right here in our own private operating room that only is cosmetic surgery. So we're not having any contaminated cases. And so you can feel a lot safer, and we can take care of you right here. You don't have to wait 8 hours in the emergency room. So you can either, contact me at drgrazer.com, or my office number is 949-644-1240. That's 949-644-1240. Or you can call me or email me at drgrazer.com. So I hope this will help you, with the mask. Again, this is the regular surgical mask. They're good. Even the cloth masks are good, but they're not going to protect you like this N95 mask or this one. Make sure you put the mask on and squeeze the aluminum tab at the top and maintain your social distance. And that's a good issue. And sometimes if you're in an area where there's a lot of people, you might want to wear a hat too. The hat protects your hair, keeps you from touching everything. And again, like I use a mask every day of my life. This is just part of my life. I'm used to it. And so be safe. And if anybody has any injuries or problems, call me. And I'm available 24 hours a day to help you out. Thanks a lot.